Can you get an eye infection from the COVID-19 test? If you're interested in finding out, keep watching. Aloha everyone, I am Dr. Rupa, ophthalmologist, and here on this channel we talk a little bit about eye surgery, we talk a little bit about eye health. I'm a pediatric ophthalmologist and I'm also specialized in misalignment of the eyes, which is strabismus. I do all of that, and my first love, which is beauty, so always talking about eye makeup and health and the products that are safe for your eyes. So if any of those interest you, please make sure to hit that subscribe button and follow along. But today we're going to be talking about the COVID test, those dreaded COVID tests with those nasal swabs, and whether or not they can cause an eye infection. Recently, Hilary Duff came out and she was all over her Instagram stories talking about how she developed an eye infection because she has to get tested so often because she's filming her TV show, Younger, and wanted to set the record straight on that. First, it is really, really unlikely that the eye infection came from the COVID-19 test. I don't know if you guys have had the test done. I unfortunately have because I was exposed to a COVID positive individual. Thankfully, my test was negative and I'm now vaccinated. But this test is not pleasant. It feels like it's going up to your brain, though it's actually not. What it does is it's a small sterile swab that goes into your nose to collect mucus from the nasal cavity in the back of the nasopharynx. Well, are the eyes and the nose connected, you might be asking? They are connected. They're connected in one specific spot. Right here, or a couple spots, I should say, right here in the bottom, if you pull your lower lid down or you pull your top lid up, you can see a little hole called the puncta. That is a connection between the eyes and the nose. That nasolacrimal system is where your tears drain, and they drain into your nasal cavity. So that's why when you're crying a lot, you get a runny nose. This is also where I do surgery for little babies that are born with blocked tear ducts. However, the test for COVID-19 does not go into the tear duct system. So definitely not violating that area at all, which is the only true connection between the eyes and the nose. The other things are, there are a couple barriers between the nose and the eyes. First, there is a fibrous sheath, which kind of encapsulates the eye. Oh, here, well, I'll show you later. I was going to show you here, but there's no fibrous sheath right there. But there's a fibrous sheath, and it's called the periorbita. So it prevents exactly that kind of connection. The other barrier is called the lamina papyracea. It's a bony layer between the nose and the eyes. So those two barriers really prevent a connection between the eyes and the nose. But what about cross-contamination? Couldn't she have gotten some kind of infection because, they were touching and they just weren't that hygienic about things? The thing about the COVID-19 test is there are really, really strict guidelines on how to do the test. You have to wash your hands and sanitize before, in the middle of, and after the test. So though possible, it's not super likely that she developed an infection from cross-contamination. So what is an eye infection? There are a couple different things that can cause redness and discharge from the eyes. First, there's allergies. Allergic conjunctivitis can cause redness and mucus discharge and a lot of itching. So likely not that in this case. There's bacterial conjunctivitis. These are all things we think of as pink eye, which causes a lot of redness, tearing, and mucus discharge. This is likely what Hilary had because she was treated with topical antibiotic drops and it seemed to get better. Antibiotics work on bacteria, not viruses. And the third is a viral conjunctivitis. And this is often what many people have when they have redness and tearing. It's not a bacterial conjunctivitis. Often it's a viral conjunctivitis, which is highly infectious. Now, COVID-19 has actually been associated with the development of conjunctivitis. The American Academy of Ophthalmology, as well as Canadian Journal of Ophthalmology, have both reported cases of this. So it is thought to be a symptom of COVID-19, but we've not had any reports of eye infections from the actual test. And in this case, Hilary tested negative as far as we know, so I don't think it was from the actual COVID-19. So there you have it. If you are feeling any of the signs and symptoms of COVID-19, fever, shortness of breath, headaches, nausea, loss of smell, loss of taste, muscle aches, fatigue, diarrhea, vomiting, any of the symptoms and your doctor is recommending getting a COVID test, please do not hesitate because you think you might get an eye infection. Though I never like to say never, that's just, I like to cover my bases. It would be really, really unlikely. It's not reported in any of our literature or by our society. So you can take heart in that. Anyway, I hope that was helpful, guys. Please subscribe. Let me know what kind of content you want to see next, and I'm happy to provide. But I needed to clear up that misinformation, make sure that everyone knew that very unlikely to cause any kind of eye infection from the COVID test. I didn't say impossible, but unlikely. All right, until next time, mahalo for watching.